You've heard a lot of comments today about the challenges that are out there in rural healthcare and the layers of difficulties that you face, many of which have financial implications. We know that we do have problems like sequestration. We see government payer cuts. We see challenges to the critical access hospital program. And all of those mean that you have to be more innovative in ways to generate revenue to advance the human mission of your organizations. We've seen our margins on an upward trend, actually, in the last couple of years. However, they've largely been stagnant around the 2% or 3% rate. And when they lurched all the way up to 4.57% this last year with the median for most hospitals, industry analysts said that we've done it on the backs of cuts. We shut down programs. We shut down service lines. We let go of practitioners. We did other things that would hamstring the capabilities of our organizations going forward. And so they said that even though our bottom lines had gone up, what we had done to get there was simply not sustainable. And while we're sitting at a 4% operating margin right now, Moody's Investor Service says that we actually need about a 5% bottom line for sustainable reinvestment in our organizations. However, many of our colleagues out there aren't even faring that well. About 25% of our hospitals are underwater. They have negative total operating margins. And with that, there certainly is not the revenue that is available to advance the vision of potential for care in their communities. We also have the problem with healthcare reform. A pundit said that healthcare reform is kind of like a unicorn, that everybody knows what it is, but nobody's ever seen it. As we move toward implementation, we know that there will be additional challenges to Medicare. And we know, looking at our rural organizations, that you have a disproportionate share of patients who utilize Medicare. Because when you look across our communities, we tend to have a median population that is older than those that live in urban centers. So you reach a point that cost is not going to get you there. You have to find a way instead to generate additional revenue resources that can enable you to pursue the good that you have in mind. We know with that revenue from operations is simply not going to be enough. There must be alternative revenue sources. Now, there are 4 different ways to bring capital into the healthcare organization. The first is that dominant lion's share approach, revenue from operations. The second is that we can borrow it through debt. However, since Moody's downgraded the outlook for hospitals and reversed it from positive to negative back in 2008, they've never revised the outlook for healthcare back to positive, which means it's very difficult to access money through debt these days. We also know another strategy is that we have money that we procure through sale of assets. But not many of us have an extra piece of property, an extra building, or a piece of technology with a usable life that is left in our organizations that we could sell to generate proceeds. And so the 4th door becomes healthcare philanthropy. Healthcare philanthropy has been written up as being the most under-optimized opportunity that we have in healthcare. It's something that has often failed to get on the radar screen, to be something that people are paying attention to. And in part because we have denigrated philanthropy by making it in some part a decorative social endeavor in many of our organizations. However, to look at the potential that healthcare philanthropy offers, last year our hospitals raised $8.41 billion. Those are just our hospitals, our FQHCs, there are other organizations that function like hospitals. It doesn't include, say, the American Heart Association and other allied health organizations. You'll also notice with this trend line that it has typically been a growing trend line. We saw a downturn after 9/11. We saw a downturn after the economy tanked in 2008. But by and large, this has been a growing and increasing pie of resource for our hospitals. But here's the slide that most CEOs care about. Philanthropy can deliver return on investment. If you look at a hospital that's performing at the median right now, they would have to generate $21.88 million to put $1 million on the bottom line from operations. Whereas if you look at a typically performing healthcare philanthropy organization, they would need to generate $1.53 million to put $1 million on the bottom line for reinvestment. With that, my conversations with CEOs often turn to, What service are you going to start? What program are you going to start? There's often not a new programmatic capability that you're even planning to bring to your community that could generate that additional $21 million. However, if you knew that you had, say, a service that you could bring online that would have a return on investment like this, wouldn't you ensure that you had positioned it well, that you were adhering to best practices, that you had hired qualified staff, that you had appropriately invested in ramping it up and making it something that really worked in your organization? I think it's a question for each of us to ask ourselves about the opportunity that presents itself for philanthropy. There's also with philanthropy clear room for growth. We know that in many of our hospitals, philanthropy currently provides less than 1% of our operating budgets. Whereas if we look at the university environment, it typically provides about 7% of their operating revenue. The only difference between the funding, the way we raise money in hospitals and in universities, is how it's prioritized. We're using the same tactics and tools, we're using the same analytics, we're using the same programs. It really comes down to, in a university environment, there's an expectation that people act like the university is a nonprofit that is worthy of charitable support. That repositioning deploys everyone to the task and makes it something that is also a key part of the role of any executive who is there. Now, I would tell you, though, that even with those numbers, I was just in a health system that while you look at their total operating dollars, it's around, say, 1%. When you look at their net operating dollars, many organizations are finding as much as 30% of their bottom line is actually coming from philanthropy. If you could add another 30% to your bottom line, wouldn't that be worth it? It's also worth thinking about development, that it is not a cost center. Many people talk about their fund development office or their foundation, and they talk about the cost center that it is. But it is a profit center, just like many of your clinical operations services. And so with all those things, philanthropy can be the meaningful, sustainable revenue resource that can help propel not only sustainability, but also reaching the aspirations you have for your community. Now with that, I want to make a distinction between fundraising and philanthropy. Fundraising tends to be a word that kind of denigrates the practice of inviting people to be part of our work. Fundraising is transactional in nature. I ask you for money, you give me money, our relationship ends. It's often something where money is given in response to a trigger. However, philanthropy is about working with people on projects that are consistent with their values. Philanthropy is about standing shoulder to shoulder and looking at what we can do together. Philanthropy is about partnership, and philanthropy is noble. I would tell you, too, that donors who participate in philanthropy say that when they look back upon the gifts they're made, they associate it with words like euphoria. They pull out words like purpose, because giving felt good to them. They did not feel like you would ask them to be part of something that was not important to them. They felt just the opposite. You had invited them into your family. Now, when I talk to people about that, they'll say, okay, I can buy that philanthropy is noble. I can buy that we should invite people into our house. But what I'll tell you is, we don't have any rich people in our community. I hear that all the time. And Mark kind of addressed that even earlier today. When you look out in rural communities, you often do not see conspicuous consumption. You don't see flashy houses, flashy cars, and flashy clothes. However, conspicuous consumption is not about wealth. It's about spending. When you look into rural communities, you often see people who are savers, who are conservative, and they have great wealth. I always think about the story of Carlos and Margaret Mason. If you live in Georgia, you may have heard of their story. He owned a dry goods store. They lived in an apartment. They didn't own a car. They rode the bus. They shopped for all their clothes at a discount store. And when she passed away, second of the two of them, they left tens of millions of dollars to benefit healthcare causes in Georgia. There was money, but there sure wasn't conspicuous consumption. We see it over and over again. If you even look at the work that was done by Thomas Stanley in The Millionaire Next Door, he said, your millionaire is likely not going to be driving a flashy Lexus or BMW. They're driving a Ford F-150. So you do have that opportunity in your community. You sometimes just have to be more diligent about uncovering those people who have both the financial ability and the affinity for your work. Now, admittedly, it's not a level playing field. It is harder to raise money in rural environments than it is, say, with big brand-name health systems. It is harder to raise money in rural environments than it is in densely populated, wealthy communities. You face challenges like grant, provision of specialty services, because we know that most money given to healthcare in the United States is given for cancer, cardiac, and kids. But you're touching people through cancer, cardiac, and kids, just sometimes maybe on a different level and in a different way. It's about ability to invest in development. You'll see small hospitals sometimes, small community hospitals that may have a dozen development officers. However, when I look out across the landscape of rural healthcare, you often have one person, and that person is wearing hats that include philanthropy, marketing, volunteer services, public relations, and other things. It's not been a service that has been invested in, and so it's not been able to achieve the potential that it might have. You also often have a lack of depth and breadth of the development program. You have less staff experience, and you have a smaller pool of prospective donors. So when you look at those challenges specifically, the first is making that commitment to have the resources to invest in not just capacity for your program, but growth. We know that those programs that evolve to a different level are those that really bring in a return on investment. So we're going to talk a little bit today about what that looks like. Low bandwidth programs where you have minimal investment and poorly trained staff often participate only in annual giving activities. Annual giving activities are fundraising. They are not philanthropy. They are your direct mail programs, your telephone solicitation programs, your special events. Well, that was exciting. And other things that don't allow you to really pull people in a mission-centered way, in a way that Major Gifts does. You also tell me a lot of times that you have a hard time attracting talent. You say, I can't go down the street and hire away a gift officer from someone else. I can't go find somebody in a big city and move them to us because they stay for a couple of years and then they leave. I would tell you that finding someone who has fit, passion, and star potential to be an advocate for your mission is more important than even experience. You can get them experience, and you can find others to scab up next to them who have experience. A limited pool of quality donors is also a challenge, but you also have a lot of people in your communities who have assets that are illiquid in nature. You have a lot of communities where you have farms, where you have large tracts of family land. Those are not as easy to give as liquid assets like cash. However, if you implement a plain giving program and have people with just the basic savvy to be able to talk a little bit about the vehicles and what could you be used in them, you don't have to have a fully trained planning officer. That's where you can pull in your allied professionals like your local attorneys, accountants, and others to help aid you. If you're just able to basically direct people to the opportunities there. So in thinking about structuring the fund development program, most of our organizations in this country use a separate 501c3 foundation. You can also use an internal development office, but even beyond those structures, some organizations that don't feel they can build one of those will use a community foundation, or will even use a bank trust department. All you need to do is build a bucket. It doesn't matter that much what the bucket is, because performance does not change significantly between the types of buckets that are there. And then you need to think about building a program that is comprehensive in nature. We know one of the things that correlates strongly with success is having a program that includes both annual giving, major gifts, and planned giving. Annual giving is all those base building acquisition programs where we invite people in. Those are the things that do look a lot like fundraising, like mail. But major gifts is where we start to have those values-based relationships. We're asking people to invest in our work. Planned giving is where people are giving us a gift through a legacy vehicle or through a more hard-to-value asset. I'd say that this is more like a vortex than it is a pyramid, which we've traditionally seen, because as we pull people closer and closer into an institutional hub, we build the requisite trust and relationships to invite them to be a closer member of our family. The most important thing to know is that special events are not the ticket. Going into rural organizations, special events are often the cornerstone of their entire program. They may be running themselves ragged with successive events in a single year. Special events have the worst return on investment of any development strategy. They typically cost about 50 cents to raise $1. And these organizations are advancing something that is not about philanthropy, it's about selling a ticket. Often the patrons who come to special events don't even know what cause they are benefiting when they come. So if it is the beginning and end of your fund development opportunity, you have something more to capture and something to grow. We know that most money actually comes in from relationships. In fact, 60% of total dollars in the typical foundation comes in from gifts that are just given outright to the organization. We know that many of those events are precipitated by a patient care experience, so it's important to then align it back against your organization. And then, as I said earlier, plan giving is an essential strategy in rural health. If you know that you want advanced plan giving, but you aren't sure where to start, the clear place to start is around bequests. 70% of planned gifts are actually bequests. It is as simple as asking someone to name you in their will. You do not need a lot of technical expertise, but the opportunity is there. And as Mark said even earlier today, people who earn their money in your community love your community. They want the money to stay to fortify your community for the future. Now, when you think about building a comprehensive program, you can buy it or you can build it. There are a lot of strategies that are within fund development that do not need a great deal of personalization. That again often gets into those annual giving programs like direct mail. You can also buy a lot of resources off the shelf. What you really must build within your organization is that relationship management capacity, because it is the one unique thing that only you can do. You can invite somebody in from out of town to do a lot of the other things that don't require touch. But it takes your voice, your passion, your relationship, your understanding of your culture to go and sit knee to knee with someone in their living room and talk about how they want to invest in the work that you do. I think about it there in terms of the story of Icarus. I don't know if any of you have read Seth Godin's book, The Icarus Deception, but he makes a great point. He says that when we hear about the story of Icarus, we heard how Icarus' father, Daedalus, built these wings for him out of feathers and wax. And we hear that he told him, when you fly out from Crete, don't fly too close to the sun. Your wings could melt, and you could plunge into the sea and die. But the second part of that we often don't hear when the tale is repeated is that he also said, and don't fly too close to the sea. If you fly too close to the sea, your wings can get wet and the feathers will get heavy and they will fail to lift you to take you where you could go. Often when I look at philanthropy in rural environments, we have flown too close to the sea. We have done that because it was safe. We have not had the purpose, the intent to build that big program. Instead, we have been timid. We've said we can't do it or we won't do it. But I think that there's an opportunity to just raise our sights. I think it is more dangerous to fly close to the sea than it is to fly close to the sun. Hubris is not an issue here. And so with that, what are some of the elements in a platform for performance? The first is a powerful case for support. Going out into organizations, I'll often say, what is your case for support? Why should people give money to you? And they'll say, we're a hospital. That's not a case for support. People need to know exactly what you want to do. What impact do you propose to have? How are you going to touch and change people's lives? What part of your aspiration is so urgent and compelling and exciting that they simply must be part of it? We're a hospital is a statement, but it's not a case for support. And we'll talk more about case in a minute. The next opportunity is building a platform for performance through fund development operations. I will tell you in talking to CEOs, they often say, oh, this philanthropy stuff is too squishy for me. It's all art and relationships, but I want business diligence and I want science. There is business diligence here. We know that programs that are highly effective are using tools even like Lean Six Sigma to overlay strategy through process. We know that organizations that are very successful are using data well. You should expect the diligence of business out of your fund development office. I said earlier that we've allowed this to become sometimes a decorative social endeavor. If it's a decorative social endeavor that is more about art and has no science, it is not achieving its potential. There are things you need to push on, things you need to evaluate. The third opportunity is about building a culture for philanthropy. Now, there's a lot of kind of kumbaya stuff out there about building culture for philanthropy that says that we should limit our focus to making sure everyone in the hospital knows what philanthropy is and what philanthropy does. But a platform for performance through culture is much broader than that. I want to focus on a few of the strategies that are most important to you today, but I want to just give you a comprehensive view in this chart of the many moving pieces that come out of a healthcare organization beyond just building a fund development effort. So the first of those most important cultural ambitions is building strategic alignment between the vision of the organization and the funding priorities. Funding priorities should not be the things that are left on the chopping block after everything important has been done. Funding priorities should not be the things that were cooked up in the foundation boardroom that everybody thought would be fun. Funding priorities need to be very tightly aligned with your highest vision of your potential for the organization. Because donors want to be part of high-impact aspirational projects. They don't want to do stuff that nobody else thought was important to fund from the budget. Instead, you invite them to be part of your highest purpose work. And so with that, sometimes it's helpful to get your hands around how you're going to define your funding priorities, I think by putting things in buckets. The first bucket is all about strategy. What do you propose to build additional capacity, to propel your future, to build new buildings, to buy technology, things that are going to take you to a different place? Then there are the things that go in the mission bucket, which often don't have a revenue stream associated with them. But they may be your pastoral care program, your social services program, other things that you think are fundamental to building an excellent patient care experience and that really speak to the emotional and social needs of the patient as well as the clinical needs. And the third is the mandate bucket. Nobody wants to fund the mandate bucket. If you know that you have to implement seismic upgrades and sprinkler systems and new baby alarm monitors, those are not the things that typically excite donors. So if you can go to the first two buckets first, it finds a place of resonance and pace and interest. I would also tell you that you've got to think about money in a way that's like having air in a balloon. If you have air in a balloon, you can push it from one side to another. If you go out and you raise money for that exciting, compelling, urgent, visionary project, you can then take money that you would have spent on that and build it to pay and use it to pay for the parking lot. Invite donors to be part of the things that are exciting, then divert funds other places. The next key piece of culture is about case for support. I've already mentioned some of the elements of an exciting case, but I want to just give you a few more thoughts about case. Traditionally, case in the rural healthcare environment has been about access. It's been about getting people access to providers. It's been about opening out other outlets. It's been about other things like that. However, you've not always asked people again for that word aspirational, those exciting things that you want to do, that are your vision of your potential. Give yourself a promotion. Think about the things that you could do that are really compelling that would pull people in. Access is exciting and access is fundamental, but there are probably other things you do that are going to touch the heart of the donor in a different way and can be more resonant. I also talk to a lot of rural healthcare providers who say, we don't have a case for support. You know, we're just providing primary care. People in our community see us as a Band-Aid hospital. Well, I will tell you that most people, as you know, their most important relationship is with that primary care provider. That's where trust is often founded. That's the person who's held their hand and navigated them through most of the health questions and crises in their life. You have a resident case in primary care. You even have a resident case in discovery, in being the person who steps in and helps people resolve what is going on. So don't allow yourself to take the excuse of saying, you know, we don't have that big, sexy, whatever it is that you think you should have to raise money. And then you've got to think about your mission case. You are not in the healthcare business benefiting people. You are in the people business deployed through healthcare. This is always about how you're going to touch and change people's lives. This is always about providing hope and healing. This is always about people. The other thing that's important to know is that people are not motivated by needs. They do not care about sequestration. They do not care about challenges to your critical access hospital status. They do not care if your government payments are being cut. What they care about is, what do you propose to do? What impact do you want to have? Donors are oriented towards solutions. Don't go to them with needs. They don't respond to needs. Invite them to be part of something bigger. And with that, your case is ultimately rooted in abundance. When you look out across your community, you see many things that you could do to elevate the standard of care, to raise wellness, to do other positive things. Invite them to be part of those abundant solutions that donors can enable by giving you financial investment. It's also important to talk to people through not just their heads, but their hearts. What we know is that giving is rooted in the psychology of behavioral economics, that people make a decision first to give emotionally, and then they go back and they validate that through facts. If you go and you barrage people with statistics and spreadsheets and numbers, you have shut off the core method by which they're going to decide to give to you. So instead, you have to make that emotional connection with them first to again let them see the impact on people. The third huge cultural opportunity you have is to engage your advocates. You can't have that one-third person, one-half person, one person sitting in the development office be the only advocate out in the community talking about the role and impact of philanthropy. You have an opportunity to take those within your walls to become a chorus of believers. It's not just your development person, it's your board, it's your physicians, it's your executives, it's others who care about and understand the work that you do. And so with that, start with yourself. If you are the chief executive officer, you are setting the normative behavior within your organization. You are elevating the priorities. Your directives are the ones that get done. To be able to talk about what the financial rationale is for philanthropy and why it's an opportunity that you should pursue, your voice gets listened to. You have more influence than any other person in the building to make this something that goes on the list. And then think about your employees. Your employees are the front line of patient care. And many of them will say, well, I'm not here to raise money. I'm here to be a nurse. But it goes back to the classic Disney idea of task versus purpose. This fellow on Main Street is there to sweep Main Street. But when the sweet young family comes up to him and says, will you take our picture in front of Cinderella Castle? That becomes his purpose. Because his highest purpose as an employee at Disney is to create happiness. The highest purpose of everyone within your walls is to advance health and healing. Philanthropy can become the mission heart of your organization. And again, then, it becomes part of what everyone does. You have to also think about your physicians. Study after study that is done said that physicians have more influence over a donor's decision to give than anyone else. And why? It's because 88% of patients say that their decision to give was rooted in gratitude. And when you ask them who got them better, they'll name their physician. Even if they were surrounded by nurses and techs and phlebotomists and transporters and whomever else it may be, they will name their physician. So their physician brings not only the gravitas of the white coat and a clear understanding of the clinical aspect of the case, but they also are the ones who galvanize gratitude. Now, people struggle with how to invite physicians to be part of this work, and I'll tell you, most physicians are concerned about HIPAA because they don't know what the rules of engagement are. However, your fund development organization is allowed to know the patient's name, their condition, the name of their physician, their treatment dates, their gender, their age, all those things that mean that your fund development office is part of the extended care team. It's allowable for them to have this information under HIPAA. The other thing they're worried about is the ethics of it. And the American Medical Association has an explicit policy on solicitation by physicians that basically says they can't be asking for the money for themselves. Most of them can understand that pretty well. Then you've got your boards as another opportunity. People often focus first on your fund development boards. I appreciate again in Mark's talk earlier that several of you said, these are influential people in our communities. And these influential people also are honest brokers, because they know if you walk in as an employee of the hospital, that you were hired by the hospital to go out to tell the story of philanthropy. When a board member comes in, they're able to say, I'm here because I believe in it. I know it's important, and I know that you want to be part of it too. They're also best able to challenge their peers through personal giving and invite them to come in. So board members are an essential piece of the solution. If you have a foundation board, though, there must be clear transparency about their role. A lot of foundation boards that I get to talk to aren't really sure why they're there. They don't even realize that their explicit reason for being is to raise funds. They think they're an ancillary board for the healthcare organization. They think they're there for some kind of programmatic function. They don't necessarily understand that their beginning and the end of the reason that they're there is around raising money. I would be very explicit from that about the outtake, so they're able to fulfill their role to the highest point possible. And with that, you see these critical commitments over and over again. They must be willing to participate both in terms of their time and in terms of their talent and in terms of their treasure. A board member who does not give is a tremendous detriment to you. It's like going in somebody's house and saying, hey, you gotta buy this stock. It's the best thing since Google, you gotta have it. And they look at them and say, well, how much did you buy? And they say, well, I didn't buy any. If you have a board member who's going out and telling everybody else about the board and they've not done it, it's very deflating to your case. We know that, in fact, who asks someone is more important than even the performance of the program. Because there are weak market forces in philanthropy, and so the influence of the asker is often one of the most important considerations in a donor's decision to give. Board members give your program both access to their own networks and signaling of the value of the cause. So as you recruit people into your endeavor on your foundation board, don't make this your JV team. Don't make this the place that you put old governing board members out to pasture. Don't make this the place that you groom the youngins to put them on the big board. You've got to make your foundation board a group of folks who have this connections, savvy, stature to be able to advance philanthropy on your behalf. And with that, I would also tell you that you squander a tremendous opportunity if you do not involve your governing board. Many governing boards passed off their responsibility to the Fund Development Foundation to wash their hands of fundraising because they saw it as an ancillary task. And in a time when most of our foundation offices were in this decorative social endeavor, they're throwing parties and doing fun things down the hall down there, it was understandable. But the reality is that if these folks are going to provide the strategy to advance your future, they can't just build the rocket, they have to build the launch pad. If they're going to spend your money, they need to also ensure you have the financial wherewithal to afford the vision you have of your potential. Now, when you talk to these allies, be it board members, physicians, executives, employees, about their comfort in raising money, most of them will say, I am not there. In fact, 59% will say that they are uncomfortable asking. They don't want to damage their relationships, and they don't know how to do it. I was with a board a week ago where I appreciated that at the end of the session, a board member said, I'll tell you, I came in here mad that I had to sit here for this fund development retreat all day because I'd already dug my heels in. I wasn't going to ask anybody for money. But she said, you know what? Over the course of the day, I see this in a different light. I'm putting out my tin cup. I'm going out with my noble hat on, and I'm going to invite people to be part of my work. And by giving them the clarity of what their role could be and giving them the tools to be successful, people are willing to step up for you. I've told a story before, and I see Bill over there. Bill's heard me tell this story before, that there was an excellent surgeon that I had the opportunity to work with. And he said, you know, I went through residency and fellowship to learn to hold a scalpel in my hand. There is no way I'm going out there and asking people for money without being trained on how to do it. We're all high-performing people who want to be successful. We want to be given the tools. So if you're going to deploy these advocates to go out on their behalf, make sure they know how to talk to people, how to start the conversation, how to answer the objectives, and when the time is right to potentially ask. Now with that, I would also tell you that there are a lot of valuable roles along the spectrum of fund development. It's It's not all about that moment where you're sitting there asking someone for money. There are a lot of things that people can do to invite people into the organization, to help cultivate their interest, to provide them with education, and to even steward them after the gift is made. If people can find that place that is right for them, then they're more likely to find a way to be part of their work. There's a story I love about a scientific experiment that was done where half of the room was given a piece of paper with 5 numbers on it, and the other half of the room was given a piece of paper and a pencil and told to write 5 numbers down. If you went to the people that you just given the numbers to and you offered to buy this lottery ticket back from them, they would readily sell it to you. But those of you who had the chance to write down your own numbers were reluctant to sell it back, and if you did, you wanted a premium for it. I think that with thoughts like that in mind, we can't just go to our board members and say, we want you to make 3 calls, sign X number of letters, do this, this. I think we've got to be able to go to them with less of a task orientation and say, here are some of the many things that you can do that will be valuable on the spectrum of development. What do you want to do? What do you like to do? What fires you up? What are you passionate about? What do you feel you'll be successful in? Because by giving people the opportunity to write their own lottery ticket, we've given them ownership of everything that comes after. Another tool that I found immensely helpful in going out and working with board members is using information from Malcolm Gladwell's book, The Tipping Point. If you read the book, you know that Malcolm Gladwell talks about 3 different archetypes. The first on the left is the maven. The maven is someone who collects knowledge. They put it in context and they give it back to other people to use. The second person in the middle, he calls the salesperson. I prefer to call the closer. They're the one who wants to go in and they want to bring you to a decision. They want to secure your agreement. And the third person on the far right is the connector. They're somebody who knows everybody in town. They're a walking Rolodex. And you call them if you need a plumber or a job. If you go and you talk to board members and give them a very simple self-test to say, where do you find yourself? If you're a maven, oddly enough, you like to read junk mail. If you're a connector, you love to go out and go to a party. If you're a persuader, you're the one who wants to move people over to your side to have them agree with you. If you can allow people to go through and find themselves here, and then say, these are tasks that would be great for you. I have a client in Missouri that got so excited about thinking of themselves as mavens and connectors and closers that they all went out and got themselves necklaces that had their color for what they were. And they started to kind of wear it proudly as a badge because they knew if they were going to go on a call that a connector needed to find a closer and needed to find a maven to go with them. Now, interestingly enough, in talking to CEOs and physicians, I have never met one who is not a maven. So I'm imagining there are a few mavens in this room. Mavens are great at selling the case. They can take the rationale for fundraising and put it in context. They can talk about what the implications are to the rest of the organization. If you find yourself to be a maven, your job is not to ask and close. Your job is to illustrate the opportunity. If you can find your place in this mix and get yourself active, it's a great service you can do to yourself and your organization. And if you find that you simply cannot ask, if you will train people to simply pick up the phone and call their friends and say, I would like to invite, insert name of fund development officer here, to come see you. And they have 3 questions for you. I've asked you to talk about the strategic priorities of the organization, what impact they'll have on our community, and your personal interest and ability in joining us. If somebody hears those 3 things and they say, I don't want to talk to them, then what you've actually done is gone from a push methodology where you're cramming them into trying to give to you, to a pull methodology where you're starting to respond to the interest that they've already indicated. If people start to do that, your development officers are often very comfortable, I hope they're comfortable, in going out and illustrating the opportunity and inviting people to give. So if your advocates can just help set them up. Now that also, of course, has implications for the type of development person you hire. If you have hired somebody because they are great at logistics for special events, but they would rather sink into their shoes than go and have a need-to-need conversation with a donor about their values, their ability, and how they can get involved, you may need to think about who your development officer is. I think the other thing that's important to think about in philanthropy is the path that got us all here. Most of us came into healthcare felt that it was important. We came into it because we wanted to make a difference in the world. We wanted to help people. And when you talk to people about what they most want in life, a Gallup poll said that 98% of people want purpose. What a wonderful place to deploy purpose in your mission, in your work. You touch lives, you save lives, you change lives. You give children back the innocence of childhood. You give fathers the opportunity to dance at their daughter's wedding. You give people the opportunity to travel in retirement. You give people back what matters to them most. And so with that, I would take you to another place. You have all been that child that went to the diving board and looked up. It was 20 feet off the ground and it looked glorious. And you scramble up the ladder and you get to the top and you look out and you think, what have I done? How did I get here? And you kind of stand there and you look around because it's terrifying once you're up there to actually get off of it. But you don't want to be so embarrassed by climbing back down. And so you stand there until you ultimately muster your courage and you jump. And what happens immediately after you get in the water? You run back up. I would encourage you to jump. Go back and start to invite your communities to be part of your noble work. Go back and invite people to be part of your purpose and deploying theirs. I promise that if you will just jump once, you will scramble back up the ladder again. Thank you for the opportunity to be here.